All right. So today is kind of a continuation of one from the other day where I was talking about disc herniations and returning and return to activities and things like that. And I think this is just another little idea from some people in the training group, online training group that I work with outside of clinical practice. To help people, help different athletes work through problems through an online group, but also help clinicians and coaches help their athletes work through problems. And so this is like just something to consider. 40-year-old client stopped training in February with sciatic nerve pain. Person had been doing progressive strength training on their own for quite a while, and then had hired this coach who was bringing this question up to help them through a little bit more. Um, the person had some imaging done, and the MRI reports came back as an L4, L5 herniation and an L5S1 herniation. The L5S1, according to the person who left the question, uh, slightly larger than the one above. And so the person was told, went in with the sciatic pain, was told, hey, you have these two herniations and disc degeneration. So you need to stop with the training and take this gabapentin and Tylenol, um, and go to physical therapy. So the first thing I want to address is, I think it's a little aggressive treatment plan personally, but that's fine. Depend on who you go to is what kind of treatment you're going to get. But the big things to remember is like how in getting this person to move forward after these injuries and after this pain, you get this person to get back into productive training. The big barrier is going to be, how do you get them comfortable again after whatever was discussed with them around the imaging and whatever was discussed with them by whoever read them through the imaging report. That whole scenario can really affect the future outcomes for this person, depending on how the discussion of the disc herniations and the degenerative disc disease on the report was handled. This person ended up with a gabapentin prescription and told to stop training and go to PT. And unfortunately, that is going to leave it very difficult to get this person back into productive training once they start to feel some improvement in their symptoms. The big thing to remember as a coach, if you somebody who coaches people, or as a clinician, is a disc herniation is common. Like if people are 40 or older, they're probably going to have at least one somewhere in their body. And strength training or disc herniations are not a contraindication to training. There might be some things that people find uncomfortable for a while after they've, if they have a symptomatic disc injury, but it doesn't mean that the person can't get back into doing some sort of strength training. It's just, how do you approach it as the coach or the person, and just understanding that things are going to be uncomfortable, and but the body does go through inflammatory healing and adaptation process with disc injuries, and eventually as long as you can find ways to continue to train the person that are comfortable for the person has confidence that you're helping them do the right thing, and that they can tolerate the loads, the volumes, the intensities, and the exercises you're having them do, they can continue to do whatever they want. If disc herniations were that severe or fatal, there wouldn't be any people left because pretty much everyone has one to some degree or another as they age. So you just have to be prepared to help a person like this coming out of an injury who's been on medications and has been told to cease their training. You have to be prepared to have some of those conversations with them about returning to doing things that they enjoy and returning to doing things that are comfortable. Because in the end, getting the body, because otherwise what happens is the body becomes detrained and deconditioned, and then they end up, worse off in the long run. So you have to remind them that we have to find some way to keep going, and eventually symptoms will subside and you'll be back to doing pretty much everything you were before you had a flare up. And you may have a flare up again in the future, but just understanding that it's not the end of the world. You're going to be uncomfortable for a few weeks to maybe a few months, but we understand that we can work through that, and just giving people that kind of knowledge and confidence can be enormous. So hopefully that helps some of you guys. Check my channel for more videos, and talk to you later.